Hello, my name is Dr. Ryan Landoll. I'm a board certified clinical psychologist, clinical child and adolescent psychologist, and the director of psychological testing here at the Ross Center. I'm really excited to welcome you all to our testing program. I want to invite you into our process. So we understand at the Ross Center that assessment and psychological testing can be pretty daunting to understand. There's a lot of confusing terms, and it's a significant investment both in time and money for you or for your child if you're looking for assessments for them for educational purposes. And we're really excited at the Ross Center because I think we approach assessment with a very unique perspective that is ultimately patient-centered and patient-focused. We have a team, doctorally trained providers who do psychological assessments and have a wealth of expertise in a wide range across the developmental lifespan, children, adolescents, adults, looking at forensic assessments, autism assessments, educational assessments, assessments for ADHD, as well as social emotional personality assessments. And what you can expect at the Ross Center is that our patients are given the opportunity to have an initial consultation, typically with me, where we sit down and we will go through in detail, understanding what it is that brings you in for testing, what you hope the testing can achieve, and what you'd like to see. And I will be able to sit there, ask some questions to understand a little bit about your background and history, using some information that you'll provide to me in advance of the session. And at the end of that session, you'll also leave with a set of recommendations. This could include the fact that maybe right now testing doesn't make sense for you or for your family. But if it does, we'll also be able to provide you with a detailed, personalized, individual testing battery that is able to be uniquely adapted to what your question is and also fit with providers that we have on staff. We'll be able to give you a realistic timeline for when to expect results. Typically, those are available about 4 to 6 weeks after testing is completed. And currently, we work very hard to minimize or have no wait list if at all possible. Um, you will also receive this information in writing, so you can take time to make a thoughtful and informed decision before you proceed with testing. Now, a lot of times folks are really concerned about cost. And so, as I mentioned, our goal is not to sell you on any given product, but to understand what you need in your family and build a testing battery that works for you. As a result, like I said, we will be very honest and straightforward if we feel like testing isn't going to meet the needs that you have. But if it does, that initial intake and consultation that you engaged with provides the basics, foundation, and background information that'll be rolled into the testing fee that we will discuss. So again, you'll have upfront transparent expectations and pricing, and you'll be able to leave that session with a better understanding of the testing process without a commitment and be able to be supported in whatever is best helpful for you and your family. So I encourage you to schedule a time to talk with us, take a look at our website, and hope to see you, hope to be able to help you and your family better meet your needs.